funky. My name's Steve Wilkins. I kind of straddle both worlds. I'm formerly a hospital senior executive in the marketing business development, worked with medical groups, and for the longest time I worked on the provider side. And I actually believed in the healthcare system. I put together marketing programs touting oncology programs, and we marketed to folks like the people here. And now I'm mortally offended at the fact that I did that, because I was advertising programs and services that simply did not have the ability and probably didn't have the right to try and treat patients because they didn't have the right physicians, they didn't have the right treatment protocols, they didn't have the right skill sets, and it was all about putting heads in beds. And I've, over the course of that lifetime, as a professional hospital provider advocate and whatnot, my wife was diagnosed. My wife was a nurse. She was a nurse in a mother baby in a local hospital here in the San Jose area. And she was diagnosed with stage 4 lung cancer. And she was not a smoker. I'm not going to relate another sick story here, because I'm going to try and take a slightly different approach. But what happened was, and what set me on this path and what led me here to this wonderful group of patients, and certainly you all, was that we did, as nurses and administrators, didn't know how to navigate the system. We discovered that the system, even though we knew the system intimately, didn't work. We discovered that our oncologists, medical oncologists, wanted to refer us to surgeons and proceed with treatment options that we didn't buy into without first exploring other treatment options. We would ask questions, and the questions were looked at. Well, wait a minute, you've got cancer. You don't have any time to ask questions. You do what I tell you. This is not going to be a cancer speech. But the bottom line is what they did was it set me off on a quest. And it set me off on a quest to navigate and find the best care for my wife so that she would live. And that led us to MD Anderson in Texas, which I would have to say is, and along with Sloan Kettering, are number 1 and 2 for a reason. They're patient-centered, and that, that's a term we haven't heard much about in this conference, patient-centered. So my first takeaway for all of you is patient-centered is important. It's important. But it led me to MD Anderson, and my wife at MD Anderson. She had 2 types of physicians. She had the medical oncologist, best number 1 thoracic medical oncologist in the world, bar none. He's in the literature. It's documented. Go look it up if you don't believe me. And he would enter the room with an entourage of 5 residents from all over the world. And each one of them would prod and touch and scrape and, my wife. Never did they ask, how are you? Never did they ask, how are you, sir? How are you dealing with all of this? But at that point, we didn't care because we wanted a cure. Her other doctor, the number 1 radiation therapist in the world, approached her, and the first thing he did was he squeezed her cheek, and he said, does that hurt? And we looked at each other and said, what the hell are you doing that for? But then he turned around, took her hand, and gave her a big hug, and he said, I've looked at your case, and I think I can cure you. And my wife today is alive after stage 4 cancer. After being told over numerous blogs about my experience with my wife that I'm a liar, that no one survives stage 4 cancer, well, they do. And they do with a combination of docs like my medical oncologist, who's straight by the book, technical, scientific, but they also do it because of the guys that come up and hug and show some empathy. Now, why is all this important to you? It's important because we, as our patients, and we are people, and as people, we have, needs, expectations, different beliefs about our health care that you as providers and as vendors of products need to be aware of. Some of us don't believe in medications as a first solution, as a first step for treatment. Some of us don't trust doctors. Some of us do. Some of us believe in alternative therapies that we don't want to tell you about because we don't want to be chastised and we don't want to be looked down upon or told that we're stupid or that we're wasting our time bringing in information into the office. It's interesting that the reason why people don't do that, they are honest and they professionally don't tell their doctors about certain things because they know how their doctors are going to respond. First, if the doctor listens at all, but then may likely dismiss it out of hand, or at least chuckle about the patient on the way out of the room. Our oncologist, when we told them we were going to MD Anderson, laughed and said, "Oh yeah, they think they can cure anybody." I kind of like that. Not to mention my wife, But why is this important? It's important because for the simple reason that, number one, it's the right thing to do. Patient-centered care, talking to your patients, being able to emote with your patient and empathize with your patients is the right thing to do. It's not something you as providers are comfortable doing, but I'll tell you, you need to learn how to do it. And why? Because in 2 years, your reimbursement is going to change based on this. If nothing else, your reimbursement is going to change, at least for Medicare. In 1 or 2 years, I believe, Medicare, 30% of physician salaries and hospital reimbursement is going to be driven by how we, the people you're looking up here, and yourselves, are going to vote on patient satisfaction surveys. Now, you're not going to like the surveys because it's never going to capture the right things. But we're going to vote on, did my doctor communicate with me? Did he show empathy? Did he explain things in a way that I could understand? And you're going to have to live with the consequences. Now, that is a glass half empty or half full. And I think that most people here are looking at it as a glass half full. This is an opportunity to engage the patient in and realize that we're not just numbers and statistics. We're people with emotions, with families, with needs, wants, but we're also going to become a strong voting public. And we're going to look to vote. We're going to vote about Mayo. We're going to vote about Bon Secure or about your hospital. We're going to vote about Stanford, who in many cases, from my patient experience, patient satisfaction experience with cancer patients, it's not good. And they go to other hospitals and other facilities for reasons. Academic medicine is great, but it's not very big when it comes to the patient experience. And so my takeaway for this from all you is that there's a reason why you need to hear our stories. We're not just a bunch of people up here complaining and grousing. We're human beings. We have feelings. We have families. We have health insurance. And we're going to vote with our feet. And it's going to impact all of you. And so I just leave you with that.